Hi, I am Dr. Shweta Nayak, Consultant Obstetrician Gynaecologist and Laparoscopic Surgeon, Motherhood Hospitals, Yadavgiri, Mysore. When fertilized egg implants inside the uterus, normal pregnancy happens. But whenever this fertilized embryo implants outside the uterus is known as ectopic pregnancy. It can happen anywhere in places like tubal pregnancy. When it happens over the ovary is known as ovarian pregnancy, and sometimes it can get implanted in cervix known as cervical pregnancy. This is a very strange condition where the embryo will be developing but will not result in a live birth. What happens is that as the pregnancy advances, these structures rupture and cause lot of bleeding inside the abdominal cavity, causing lot of hemorrhage, shock, and collapse of the lady. Hence, it's a very lethal condition which has to be identified and treated immediately. How can this pregnancy be diagnosed? This ectopic pregnancy is characterized by 3 symptoms. Here the ladies would have missed periods. They would have been experiencing lower abdomen pain. Along with the third symptoms be heavy vaginal bleeding. And whenever you are suspecting pregnancy and the pregnancy sac is not visible inside the uterus, then ectopic has to be suspected. And also sometimes doctor can advise serum beta HCG levels which beta HCG levels are not collaborating with the gestational age of the pregnancy. In such cases, ectopic has to be suspected. So once the suspicion is done, ultrasound is performed and that pregnancy has to be identified. So then the treatment mainly depends on whether the pregnancy has ruptured or unruptured. If the pregnancy is already ruptured inside the abdomen, lot of hemorrhage is there, hemoperitoneum is there, then there is no role of medical therapy and laparoscopic surgery has to be performed. Laparoscopic salpingectomy or laparotomy, that is open surgery followed by salpingectomy, has to be done. In unruptured cases, medical methods like methotrexate therapy can be given. So, to recognize and treat ectopic pregnancy, we have to be very vigilant and mindful and diagnose the cases and treat the patient. Since once it goes out of hand, it can become a lethal condition. It has to be tackled in an aggressive manner. And also the future fertility has to be preserved for such ladies.